Hi, I'm Dr. Nancy Hadley. This is Dr. Balson, and we are going to demonstrate your skills assessment. When you're ready to do this with your instructor, make sure you have your patient and a photo ID so you can show to your instructor. We're going to jump right in. I am going to demonstrate palpation of the lymph nodes, the preauricular in front of the ears, posterior auricular behind the ears, the occipital at the back of the head, tonsillar at the edge of the jaw, submandibular under the jaw, and submental under the chin, anterior cervical at the front of the neck, and posterior cervical at the back of the neck. Supraclavicular is above the clavicle on both sides. There's no enlargement and they're equal bilaterally. The next thing I'm going to do is cranial nerve 5, which is trigeminal. And I'm going to palpate over the masseter muscles as the patient clenches the jaw, and cranial nerve 5 is intact. Next, I'm going to do sensory, checking light touch over the forehead. Let me know if it feels the same on both sides. The cheeks, the chin. Does everything feel the same?
Feels the same.
Okay, so cranial nerve 5 is intact. Then I'm going to check the face for symmetry. I'm going to have the patient to smile. I'm going to have them frown, raise the eyebrows, puff out the cheeks, pucker the lips. Okay? Cranial nerve 7 is intact. The next thing I'm going to do is inspect the ear using my otoscope. I'm going to inspect the auditory canal and the tympanic membranes of both ears. I'm going to pull up and back. I'm going to shine the light in the external canal, and I'm going to note that it is clear, that there's no swelling or redness, drainage or cerumen noted, and the tympanic membrane is intact and pearly gray, and there is no effusion. The next test is going to be a whisper test. I'm going to whisper 3 words into the patient's ear and have them repeat the words back. Cover the ear that you are not testing and repeat after me.
Christmas. 3. Ear.
All right. We're going to do the other side, covering this ear.
Halloween. 6. Tire.
All right, so hearing is intact bilaterally. Next, I'm going to assess the eye, the optic nerve, using asking the patient to check, to watch my hands bilaterally. I'm going to try and be at the patient's same level. I'm going to bring the hands from the back. Let me know when you see my fingers wiggle.
Now.
All right. So peripheral vision is normal. The next thing I'm going to do is use my ophthalmoscope. And I'm going to check pupillary response to light, or PERLA, using the ophthalmoscope, and have the patient stare at my nose and come from this side and from this side. All right. And pupils are about 2 to 3 millimeters, and they are responsive to light. The next thing I'm going to do is the cranial nerve 3, 4, and 6, the ocular motor, the trochlear, and the abducens. I'm going to use an H pattern and have the patient follow my finger. Okay. The EOMs are intact and equal bilaterally. I'm also going to do a fundoscopic exam assessing the blood vessels in the eye. Okay, I'm going to put my hand on the shoulder so that I can guide myself in. Let me take off my glasses. Okay. The the disc margins are round and sharp. There's no AV nicking, no exudate, and no hemorrhages. The next thing I'm going to do is assess the nasal turbinates and the septum. So I'm going to tip the nose and I'm going to look in both sides. And I can see from that the turbinates are pink and moist. The septum is midline. There's no angling anteriorly, and the septum is straight with no deviations. The next thing I'm going to do is palpate the frontal and maxillary sinuses. Is there any pain here?
No.
Any pain here?
No.
Any pain here?
No.
Okay. So no tenderness is noted on palpation of the frontal and maxillary sinuses. The next thing I'm going to do is inspect the mouth and throat. We're going to look at lips, teeth, gums, buccal mucosa, the hard and soft palate, the tongue and the floor of the mouth, as well as the posterior pharynx and tonsils. Evaluating the patient, her lips are pink and moist. Let me have you open your mouth. Okay. Teeth, there are no signs of decay. On her gums, there's no redness or swelling, and they are moist and pink. The buccal mucosa on both sides are pink and moist. Upper and, soft and hard palate are also pink and moist. Tongue is pink and moist. Let me have you lift your tongue. All right. The floor of the mouth is pink, and there's no nodules or drainage noted. And posterior pharynx. All right. There's no drainage. It's pink and moist, and the tonsils are grade 1. The next thing I'm going to do while I'm evaluating the mouth is looking at the cranial nerve 9, which is glossopharyngeal, and 10, the vagus nerve. So have the patient say ah. All right. And what I see is that there is a symmetrical rise of the soft palate with phonation. Cranial nerve 9 is a gag reflex, and we're not going to test it for this exam. The uvula on exam is symmetrical with phonation, so cranial nerve 10 is intact. The next one is cranial nerve 12 or hypoglossal. So have your patient stick their tongue out, move it side to side. All right, the cranial nerve 12 is intact. Put that down. Neck, we're going to palpate the trachea and see if it is midline. All right, trachea is midline. I'm going to palpate the thyroid. You're going to find the cricoid process and the substernal notch, and you're going to have the patient to swallow. All right, there are no nodules noted on the thyroid exam. The next thing we're going to do in the neck is to auscultate the carotid arteries with the bell of the stethoscope. Have your patient to hold their breath. Okay. Hold your breath. All right. There are no bruits noted on exam. The last at the head and the neck is going to be cranial nerve 11, and I'm going to push down and have you shrug your shoulders against resistance. Cranial nerve 11 is intact.